Welcome to Rainbow Kitty's channel for parents. Nurture emotionally healthy children with us.
OCD-related conditions. These are separate conditions that are similar to, or related to OCD. Some children might be upset about their physical appearance and have fixated thoughts about it. Another condition involves persistent urges to pull out hair from any part of one's own body like eyebrow, scalp, or eyelashes. The hair-pulling behaviors are often in response to stress from school, family, or social aspects of life. The common obvious impact is having patchy bald spots and significant hair loss. This could lead to further distress due to changes in physical appearance. Depression is another related condition which can involve looping unwanted thoughts, but these thoughts generally do not lead to compulsive behaviors. Hoarding disorder is yet another one which involves collecting in excess of used or unwanted objects, and having difficulty throwing them away. These possessions do not trigger distress. Children with this OCD might feel a compulsion to complete a set, or might believe that not keeping those items might lead to some harm. Generalized anxiety disorder is a related condition that also involves frequent and persistent worries. These concerns often relate to everyday life. While they might lead the child to avoid certain people or situations, they generally do not lead to compulsive actions. Tics, or sudden, repeated movements, can also happen with OCD. It is not uncommon for people with OCD to also have a tic disorder. But you can also have a tic disorder without having OCD. Chronic skin picking is another condition which is characterized by repeated picking at one's own skin and could result in skin lesions. This can also disrupt life. Health anxiety is a condition which involves worrying excessively that you are, or may fall seriously ill. You may have no physical symptoms though. Some children might believe that they have an unpleasant body odor. This results in high distress and is often accompanied by repetitive behavior such as frequent showering. Now we have a small list of self-help books and websites that can help you understand more about OCD, and to take the necessary actions before it gets too late. Here is a list of 5 self-help books first. Up and Down the Worry Hill, by Oreen Pinto Wagner and Paul A. Jutton, is an illustrated book to help parents and professionals explain OCD to younger children. The Secret Problem by Chris Weaver and Neil Phillips is a cartoon book that describes OCD and its treatments in simple language to help children, teenagers, and parents. The OCD Workbook, Your Guide to Breaking Free from Obsessive-compulsive Disorder, by Bruce M. Hyman and Shirlene Pedrick, is a self-help manual for adults and youth which guides through the exposure and response prevention for OCD and has advice for family. Overcoming Obsessive-compulsive Disorder by David Veal and Rob Wilson is a self-help book suitable for adults and youth. Brain Lock, Free Yourself from Obsessive-compulsive Behavior by Jeffrey M. Schwartz is a self-treatment manual suitable for adults and youth. We have shared links to shop for these books and also to a few self-help websites in the description. Please have a look at them. That was all we had to share on OCD. Watch Part 1 to know more about signs and symptoms of OCD, Part 2 to understand the possible causes and risk factors, and Part 3 to know about the treatment options available for OCD. Links are in the description. Please let us know if there is any other topic that you might want us to discuss about. We will try our best to include them in our upcoming videos.
Like, share with your fellow parents and subscribe to get notified.